Hello, welcome to Mission Alive once again from MSC Mission Office. I want to speak this morning of a project which we funded late last year. It's funded through an Australian group of health workers, and it's called Taking Paediatrics Abroad, Giving Forward and Bringing Back. The concept came from a lady, a doctor, professor, who had worked in countries in the Pacific and Asia and saw the absolute need of more skill, knowledge and expertise in paediatrics, the health of children. The concept that she came to was to send paediatric nurses and doctors overseas to work with staff in those other countries, and so to gain experience themselves and to impart knowledge and experience and expertise to those health workers, doctors and nurses in those other countries. And they would bring back with them the knowledge and skills, experience that they had gained in that place. I met with Professor Caro yesterday just for a brief discussion and report, and it's quite marvellous what is happening. When we did the funding was to go towards initial setup, the internet setup, some insurance, some travel to those countries to meet with teams of experts, health workers in those countries to get the thing going. But then everything locked down with the COVID crisis, so the travel was not and is not possible. So what has happened is they have been thinking differently and, in a sense, going sideways, some lateral thinking, and are conducting telehealth, telemedicine with staff in those countries. And I'll read parts of the report out. They have had 34 telehealth sessions in the last 2.5 months, 14 in Solomon Islands, 31 in Vanuatu and 9 in Cambodia. They want to work also in Bangladesh, but Bangladesh at the moment is devastated by floods and the COVID crisis, so are not able to participate. But in Cambodia, for instance, 108 paediatric doctors have signed up. 40 or 50 attend some sessions from different provinces. So this is contacting these people specifically, adding to their knowledge and skills and helping them to work with real patients on the ground. For the teleconference, there is no direct contact with the patients, which is normal, but through the practitioners on the ground, they're able to assess the patient, to give advice, and so the process goes forward. Some of the sicknesses that are being looked at are paediatric palliative care, endocrine disorders, neurological problems, and asthma, as well as bipolar disorder and other psychological disorders in children and young adults, to help them with those problems and to give them a good start in life. The results have been quite startling, with many children now alive and living healthy lives because of the intervention through this system, which is a great result, and the work is going forward. There are experts in Australia signing up to help, particularly those with what they call subspecialities within the palliative care practice, subspecialities, who have skills and knowledge that others overseas maybe don't have. Maybe overseas they have had a general training, but not in subspecialities. So this is bringing together the expertise and knowledge of people in Australia with that of people in other countries, for the benefit of both and for the benefit of patients, of children. So we have been very happy to have a part in funding that, and the group involved is very, very grateful for what we have done. And I'm quite amazed at what has been done in terms of saying, well, we can't go this way and visit these places and go to those places, but we'll do it a different way through the media, through the social media and the health telemedicine, which is a great concept, and it seems to be working. So this also is mission. It's not specifically a Catholic mission or a Christian mission, but it's a very, very human mission. That there are young people, kids, children who have serious health problems who would die otherwise, and through this means they're able to bring help to them and to save lives. So this is very much Mission Alive, on the ground, doing real work. Thank you for being with us this morning.